Hello, everybody. Welcome to Divergent Video Blog Series. I'm your host, Shelly Jadeja, principal with Divergent, and I'm so excited to have my colleague, Steve Vinehand, Vice President of Growth and Customer Experience, join me for a conversation today on a topic that both Steve and I are very passionate about. Welcome, Steve.
Thanks for having me.
So, Steve, provider burnout, struggle with physician efficiency that our healthcare organizations are particularly struggling with over the last 14 to 16 months, though not a topic that is just limited to that. It seems it's been exacerbated since the pandemic due to the increase in volume, the longer hours for our care team, the excessive use of technology and introduction of a lot newer technologies into the workflow that has contributed to the burnout amongst various other reasons and to the inefficiencies in workflows. I know this one topic you have worked on quite a bit over the last several years, working with healthcare organizations in putting together programs to approach and tackle this problem from various perspectives, from system optimizations, technology optimizations, from workflow optimizations, from education and training, from really the governance to really build the trust around and getting people to commit to that program. But one aspect of your approach to tackle physician efficiency and the provider burnout particularly excites me, being the data nerd, is really tackling, leveraging data, be it our data from EMRs, be it the financial data, the cost data of the organization, the volume metrics per service line, the data around the provider burnout, provider attrition, and really pulling it all together to build a predictive model, analytic model that healthcare leaders can use to truly understand what is the impact on their financial bottom line with the physician or care team inefficiencies of provider burnout. And understanding that if they were to make an investment in various efforts and projects to tackle this, what does that investment look like, and at what rate can they realize a return on investment from the investment they make into these programs? I'm so curious to hear, what is your take on this data-driven approach to understanding the true impact and really the rate at which the needle can be moved? And what is the receptivity of that by healthcare leaders?
Talk about a loaded question, but a great one. So I hope you have some time to hear an answer. No, I'm kidding. I'll keep it brief. So fantastic topic. As you mentioned, there really is a great need, for some focus on this big problem of physician and really clinician burnout across the industry. So, out of the box, a lot of electronic health records nowadays have some level of usage data that organizations can view and look at, and identify some challenge areas when it comes to specific variations in how the EHR is used.
Mm-hmm.
But like you inferred, from your lead up to the question, there's a lot more information out there that really plays into burnout. And system usage certainly is one, revenue productivity metrics is another. But a big one, that organizations probably don't think as much about is more of a qualitative, type of data source around how these users, these physicians, these nurses, these other support staff are feeling about their organization. Are they feeling their voice is heard? Are they feeling that they're getting enough support to be successful in the system? And that's where those out of the box, usage analytics platforms really have gaps.
Mm-hmm.
So, one approach that we've taken is to include some sort of a survey, a qualitative, questionnaire that can be incorporated in with this more quantitative data source to identify and prioritize the areas of greatest opportunity when it comes to intervening with users. So a lot of that is done externally from these electronic health record native reports, through dashboards and tools that likely you all have heard of. But by doing this analytics work outside of the EHR, you can really build a robust platform. And it can do a lot of other things beyond just incorporating external data sources, like looking at the data longitudinally. So you can identify trends, positive or negative, over time. And importantly, that also allows you to identify or document when you intervene with that user. So if you deploy a one-on-one training session, or you deploy new EHR changes, or you deploy a new, communication tool to update users of, time-saving tricks, you can measure the impact of those interventions on end user system usage and satisfaction over time. So then you're really talking about creating that value and moving the needle on physician, nurse, and other user satisfaction. And ultimately, there's so many downstream benefits, to that, around reducing the cost of burnout and improving the culture, which ultimately can improve patient satisfaction and quality metrics and so many other things. So, with that, looking at this problem more comprehensively, that's where I feel and we feel, the greatest opportunities can be had to move the needle.
And, like I said, being the data nerd, being able to leverage the power of data to really support that decision making for the healthcare organizations and really be able to predict and quantify the impact, like you said, Steve, of making these interventions and setting realistic expectations. Maybe just investment in the training programs is really not addressing the whole problem, but to what extent can we move the needle? And it needs to be coupled with other changes. Really having a quantitative look at what I call the ROI out of these interventions. To me, it's very powerful, and in my experience, has been very well received by the healthcare leaders. Check out this short blog Steve and I have recently written about our analytic take at addressing physician efficiency and physician burnout. There is a lot more information available on this topic on our Divurgent website. It is an area we're very passionate about, and we have gathered a lot of learnings in working in partnership with our clients, and we always look forward to opportunities to have conversations and learn more about what's top of mind for you, the healthcare leaders who are on the front lines. So we welcome any thoughts, feedback you might have on our blog, or other questions that might be top of your mind. Thank you for tuning in, and we look forward to having a conversation.